If you have IBS-C, you know the feeling. Days go by, nothing moves. The bloating builds until your clothes don't fit. You've tried the laxatives, the fiber, the magnesium someone swore by. None of it holds. At the end of this episode, a cause of IBS-C that most doctors don't test for unless you ask. Nothing to do with diet. The right patients see 70 to 80% improvement. Stay for that. If you need relief today, episode 3 first, come back here when you've stabilized. This episode is for the pattern, not the panic. 90% of my bad years with IBS were diarrhea. Urgency, the bathroom running my life. But one time in 10, everything just stopped. No urgency, no movement, just that heaviness. The bloating that built through the day. The feeling of waiting for something that never came. If that's your daily reality, not one time in 10, but every single week, you already know how hard this is. No one around you fully understands what it's like. The part nobody tells you, most of it is fixable. Not in 3 days, in 3 to 8 weeks. This is the IBS-C stabilization protocol. Everything here is a 4 to 8 week trial, not a same-day fix. If you expect results in 3 days and don't get them, you'll stop something that was about to work. That is the biggest mistake in stabilization, moving too fast. Quick safety check. If you have rectal bleeding, unexplained weight loss, persistent vomiting, fever, symptoms that wake you from sleep, see a doctor before anything else. IBS does not cause those things. They need to be investigated first. I use a 3-star evidence system on this channel. 3 stars means meta-analysis backed and guidelines supported. 2 stars means solid mechanism with good but lighter clinical data. 1 star means the evidence is early. Same system as episode 3. 7 tools. Here's the protocol. One note that applies to everything on this list. Keep your meal timing consistent. Irregular meals disrupt the gut's own rhythm and work against every tool here. 3 moderate meals at consistent times. Tool number 1, soluble fiber. 3 stars. 1 to 3 weeks. Be precise here. This is where most people go wrong. 2 types matter. Insoluble fiber, wheat bran is the most common. Adds bulk. It can worsen bloating and cramping in IBS. If you've ever tried to eat more fiber and felt worse, that's probably why. Psyllium husk absorbs water and forms a gel in the gut. That gel softens stool, makes it easier to pass, and here's what surprises people. It works across both IBS-C and IBS-D. One of the very few interventions that helps in both directions. Start with 1 teaspoon per day in a full glass of water. Increase slowly every 3 to 5 days, up to 1 to 2 tablespoons daily as tolerated. Drink water throughout the day. Without enough water, soluble fiber can make constipation worse. These are standard adult doses. On other medications, pregnant or with kidney or liver conditions, check with a pharmacist first. That conversation's free. Take it. Tool number 2, PEG, polyethylene glycol. 3 stars, days to weeks. You may know this as Miralax or Movicol, same drug, different regions. Osmotic laxative, draws water into the colon mechanically. Doesn't stimulate contractions, doesn't get absorbed into your bloodstream. Just keeps water in the stool, so things can move. Most well-studied osmotic laxative available. Safe for long-term use, which matters because IBS-C is a chronic condition. 17 grams dissolved in water, once daily. Adjust based on response, lowest effective dose, not the highest. Overuse tips you into urgency and loose stools. The limitation, PEG moves things. It does not touch pain. That's where peppermint oil comes in. Tool number 3, peppermint oil, enteric coated, 3 stars, days to weeks. PEG moves things. Peppermint oil handles the pain PEG can't touch. Together, they're the foundation. Episode 3 used it as a rescue tool. It also works as a daily stabilizer. It relaxes smooth muscle in the gut wall, reduces the cramping and spasm, the pain that hits even when nothing is moving. Multiple randomized controlled trials, first line in several major clinical guidelines. 180 to 225 milligrams, enteric coated before meals 2 to 3 times daily. The enteric coating is not optional. It ensures the oil is released in the small intestine, not the stomach. Without it, you get heartburn, not relief. Add this from week 1. Don't wait for the foundation to fail before adding the next layer. If this channel is helping, subscribe. We're working through every cause of IBS, one episode at a time. Before we go further, the one you've probably already tried, magnesium. It's everywhere. Thousands of posts, hundreds of videos, accessible, cheap, and some people do feel better on it. Here's what the clinical guidelines say. The evidence for magnesium is for a different condition, chronic idiopathic constipation. And even there, the recommendation is conditional, with very low certainty. No robust trials specifically in IBS-C. At higher doses, real risks for people with kidney conditions or those on certain medications. If it's working for you, keep going. If you're relying on it as your primary strategy and still struggling, now you know why. One more thing before we continue. Most people who try the low FODMAP diet make a specific mistake. It keeps them restricted for years longer than they need to be. It's not about which foods you cut. It's about what you never add back. I'll explain at the end. Tool number 4, probiotics. 2 to 3 stars, depending on strain. 4 to 8 weeks. Honest framing. A general probiotic from the gut health aisle is unlikely to do much for IBS-C specifically. The research is strain-specific. Taking the wrong one is the same as taking nothing. One strain, one product, 4 to 8 weeks. Track your symptoms. 30% or more improvement. Continue. Less than that, stop and move on. Don't stack multiple probiotics at once. You won't know what's working. Most people are taking the wrong strain for their subtype. Episode 11 is where we fix that. Tool number 5, prescription secretagogues, 3 stars, weeks. This is the prescriber escalation step, not over the counter. There's a class of prescription medications approved specifically for IBS-C. They increase fluid secretion into the intestinal lining, softening stool and speeding transit. But unlike PEG, they also reduce the nerve sensitivity that drives pain. Both problems. One mechanism. If you've tried fiber and PEG and you're still not getting adequate relief, or if pain is dominant. This is the conversation to have with your gastroenterologist. Strong evidence base, multiple randomized trials, regulatory approval. Main side effect is diarrhea, which usually responds to dose adjustment. Your doctor will walk you through what fits your situation. Tool number 6, low-dose prescription neuromodulators. 2 stars, 4 to 6 weeks. Another prescriber conversation. At the doses used in IBS, this class of medication is not being prescribed for depression. It works directly on the gut's own nervous system to reduce pain signal transmission, and in some cases to modestly speed motility. The effect is in the gut, not the brain. If pain is your dominant symptom and fiber, PEG, and peppermint oil aren't touching it, raise this with your doctor. The full explanation, the evidence, and what to expect is in episode 15. Most people who needed it were never told it existed. Tool number 7, melatonin. 2 stars. Supporting tool, 4 to 6 weeks. Melatonin is produced in large quantities in the gut, far more than in the brain, where it regulates motility and pain signaling. Small randomized trials have found that 1 to 3 milligrams at bedtime reduces abdominal pain in IBS patients. Sleep problems are not required for the effect. Pain and sleep feed each other in IBS. Poor sleep raises visceral sensitivity. Elevated pain disrupts sleep. If that loop is running for you, melatonin is worth a trial. Here's the sequence. Start with fiber and hydration. That's the foundation. Add PEG when frequency hasn't improved in 2 to 4 weeks. Peppermint oil for pain. From week 1, not later. Run a probiotic trial alongside. Escalate to prescription secretagogues with your doctor if fiber and PEG aren't enough. Consider melatonin if pain and sleep are intertwined, and if pain is still dominant after all of that. Episode 15. Track your symptoms throughout. A simple 0 to 10 score for pain, bloating, and bowel frequency each day. That data will tell you what's working and what isn't. Without it, you're guessing. Now, the investigation layer. The most impactful dietary change for IBS-C is the low FODMAP approach. Not because it treats constipation, it doesn't, reliably. Because it identifies the food triggers driving your gut's hypersensitivity. And that mistake I mentioned, it's in the reintroduction phase. Almost nobody does it. Without it, you stay restricted for years longer than you need to be. Episode 7 walks through the full reintroduction method. If your gut gets worse during high-pressure periods and better on weekends, stress is a driver. Episodes 8 and 9 cover the 2 gut-brain interventions with the strongest evidence. And now, the thing I mentioned at the start. If you've done everything on this list and things still aren't moving, there's something most people with IBS-C never get told. The problem may not be that your gut is too slow. The problem may be that the exit isn't coordinating properly. There's a condition where the wrong muscles fire. At the moment your body should let go, those muscles contract instead. Stool reaches the rectum. It's ready, but the door won't open. No laxative fixes a coordination problem. No fiber fixes a coordination problem. The treatment is a specific type of biofeedback therapy. The improvement rates in the right patients are 70 to 80%. Straining, incomplete evacuation, the feeling of blockage. If those are your dominant complaints and medications haven't helped, ask your doctor about pelvic floor assessment. Not more fiber, not a higher dose. A referral. Episode 14 covers this in full. If you still need these tools every week after 8 weeks and nothing has shifted, that's not a stabilization problem. That's a pattern. And patterns have causes. The stabilization work is done. Episode 7 is where the investigation starts. Don't give up. Keep investigating.